Welcome to Ego Over Id, the psychology of everything, where we explore the science of what makes us human and the stories that make us feel it. I'm Dr. Austin Attaway, an organizational psychologist, professor, and mental health advocate. Each episode will explore the psychology behind our everyday lives and the complexities of our experiences. Whether you're here to understand yourself, others, or the world around you just a little better, you're in the right place. This is where research meets real life. So grab your coffee, take a breath, and let's dive in. Today on Ego Over Id, the psychology of everything, we're diving into one of the most complex, emotionally charged, and culturally shaped aspects of mental health, body image. Our guest today is Dr. Zachary Soulliard, a clinical psychologist and professor at Miami University, and his work sits at the intersection of body image, stigma, and LGBTQ plus mental health. Dr. Soulliard's research unpacks how social pressures, minority stress, and community dynamics shape body image and eating behaviors among LGBTQ plus individuals. His lab's currently advancing an integrative model that brings together theories of objectification, minority stress, and intra-minority community pressures to explain why body image concerns are disproportionately elevated in LGBTQ plus populations, which we'll talk about today. Beyond his research, Dr. Soulliard is also a licensed psychologist and a passionate educator who trains future clinicians to deliver evidence-based LGBTQ affirmative care using insights from implementation science. With his experience spanning Yale School of Public Health, St. Louis University, and extensive teaching across psychopathology and LGBTQ plus mental health, Dr. Soulliard brings both scientific rigor and clinical expertise to our conversation today. So let's explore what truly shapes body image, who's most impacted, and what we can do to foster a healthier, more compassionate relationship with our body. Zach, welcome to Ego Over Id. Happy to have you.
Thank you so much.
Yeah.
Glad to be here.
Of course, yeah. So really just to kind of kick everything off and make sure that we're all on the same page, can you really help us define body image from maybe a psychological standpoint and why that's important to understand and, why it's studied?
Sure, absolutely.
Yeah,
Starting with your latter point, uh,
yeah,
you know, body image is something that is very much universal in the sense of, to not state the obvious, we all have a body across
right.
cultures, across identities, and it's something that really does connect us as a human race together. Now, the way
Mm,
that we view those bodies are very much informed by a lot of different factors, which of course we'll talk about today. But to the point of to kind of identify a psychological definition, when we think about body image, I think of it in two arms or two brackets. There's the first piece, which is really all about how we evaluate our bodies. This is
mm,
the extent to which we're satisfied or dissatisfied with our bodies, with our physical appearance. And I feel like that is commonly what folks think of when they think about body image. It's, I like my body, I don't like my body, I like these parts, I don't like
yeah,
these other parts. And that the other piece of a body image, at least as a science that we really focus on, is also the what we might describe as the investment piece of body image.
mm,
To what extent not just am I satisfied or dissatisfied with my body, but to what extent am I putting forth efforts to do something about it, whatever it
mm,
might be, in terms of the clothing I'm wearing, the makeup I'm wearing, my hairstyle,
mm.
and to what extent I'm investing in some of those other pieces of body
How'd you like
image.
going to the gym, skincare routines, things like that?
Yes,
Yeah,
absolutely. And as you might
gotcha.
imagine, this evaluation piece and investment piece certainly go hand in hand together.
Right,
But I like to mention that investment piece because I think often we focus on just what is the surface of I like my body or not, and there are other
right.
deeper aspects to it too.
Yeah, and I think that's a great point because, when I look at the conversation, at least in popular media around body image, I see a lot of just people looking in the mirror and reflecting on the parts that they like or don't like. And
Hmm.
so I really like that you brought up that investment piece. And so I'm excited to talk about that a little bit more. I do want to know, though, how did Zach get into this? How did you get into this research, particularly with LGBTQ plus populations? Was there a moment or something that just kind of clicked for you?
Yeah. I The moment that comes to mind is a moment that I actually wrote about when I was applying to graduate school for
Mm,
PhD
mhm,
programs, uh, ever since when I've been focused on body image research. And sounds really silly, and might date myself a little bit, but folks might remember the song. I don't remember who sang it, but it was definitely called something like "Let Me Take a Selfie." And it was
mm,
just this really, just
mhm,
poppy dance, I don't even know what type of song. And the music video that went with it, though, was indeed folks really exacerbating and making fun of what was very much at that time and arguably still is that focus on body image and taking
mm,
selfies and making sure the filter was right and all that. And for some reason, that song and just the folks that I was surrounded with and the society I was in at the time just really made me ponder, like, why are we so invested in not
mhm,
just our own body image, but
mhm,
how other people view our bodies, and
right,
also why we also feel the need to comment on other people's bodies at the
yeah,
same time. My research also looks at the relationship between body image and eating disorders, which is
mm,
common. And
mhm,
so, to the latter point, it really made me also think, gosh, if we maybe weren't so critical about our own bodies and other people's bodies, could that have a positive impact on these rates of eating disorders that we see in populations? And so, yeah, it's it was a really niched point as to why I got
right,
into it, but that always sticks to mind for me. Like I said, probably because I referenced it in my personal statements for graduate school,
right.
but I think that's when it really stuck to me,
I
this
appreciate that.
interest.
Yeah, I love asking about it because sometimes you do get these niche answers about what send people down their paths of research
Yeah.
that can end up, really having a positive impact on an entire population of people too. Yeah, so thank
Yeah.
you for sharing. I appreciate it.
Yeah.
Yeah. Um, so in your lab, you focus on stigma as one of these driving um, issues for body image concerns.
Mhm.
Are there specific forms of stigma that you think have, the most impact on the populations that you do study?
Yeah. Certainly.
Yeah.
I think the first type of stigma that comes to mind for me, very much influenced by my own research, is what
Mhm,
I'll describe broadly as LGBTQ related stigma, or
mhm,
stigma related to one's sexual orientation identity and or one's gender identity, inclusive of
mhm,
trans and non-binary identities. We have very specific scripts, especially in Western society, that would
mhm,
tell us how we're supposed to look in terms of our
mhm,
bodies, purely just from a gender standpoint, the notion of coming across as very muscular as a sign of one's masculinity,
right,
or for women, coming across as very thin and stealth, is also, a type of body image ideal that I think really drives a lot of what our body image concerns. So I certainly think that again, gender, sexual orientation, LGBTQ identities broadly, and stigma towards said
mhm,
identities certainly plays a role. I also would mention though too, and I think that both the research field and in the public we're recognizing this too, that weight stigma, or sometimes
mm,
referred to as weight bias, is
yeah,
also a really salient form of stigma that plays a
yeah,
role here as well. Weight stigma really referring to any form of discrimination or inequity that's placed on someone because of
mhm,
their body size or body weight. You'll often hear reports of how weight stigma is one of the remaining forms of stigma that is still accepted in our society.
right,
And I do indeed think that, someone's body size and weight and the differential impact that someone in a larger body
mhm,
experiences in comparison to folks not in larger bodies, also
mhm.
very much drives body image related concerns certainly in the US and in Western society broadly.
Yeah, I appreciate that. Just real quick for our listeners, do you mind just
Yeah.
kind of going a little bit deeper on what you mean by, scripts, and then maybe
Yes.
also providing an example or 2?
Yeah,
Yeah, yeah,
absolutely. So I
yeah,
think the two scripts that come to mind for me are by scripts broadly what we're referring to in this context
mhm,
is messages that we receive arguably from birth about
yeah,
what we should strive for in
mhm,
terms of our physical appearance. And so two body image scripts that can form into these individual attitudes that we
mhm,
hold. One of them is this script that's focused on this thin ideal, this
mhm,
ideal of having a thin body, a thin body that is prized within our society. And then
yeah,
another script is this muscular type
Mm,
ideal. This notion that, again, thinking about men in particular, that my marker of how masculine I am is completely related to how muscular I am. And so somewhere in between there then is this script or this muscular ideal then of
mm,
I need to achieve this muscular appearance in order
right.
to be masculine enough, be good enough broadly, and other aspects of measuring our own worth. So yeah, when we think about scripts, I'm thinking specifically about these different types of body image ideals, if you will.
Yeah, and kind of like how the culture and our upbringing and its society is like speaking to us and kind of what's embedded in it.
Exactly. Yes.
Yeah,
In a
gotcha.
way, if a way that honestly is really insidious. I don't know if
Yeah,
anyone has necessarily sat down and said, as
right,
an XYZ person, this is
right,
what you strive for, right?
right,
But it comes from so many influences, our family, our peers,
right.
2025 in the age of social media and other
Yeah,
forms of media as well. It's really pervasive, and that really speaks to kind of my point of since birth, where it's something that
right.
we're really surrounded by in our society.
Yeah, as you were talking about that, an example that immediately came to my mind was over the last year of teacher, or last couple of years of teaching.
Mhm.
Sometimes I'll open up a poll everywhere to my students in my lectures hall just to get to know me on that first week,
Yeah.
and almost every time, without fail, somebody asks how much I can bench, and I think that goes kind of right in line with this subscript of to be masculine, you need to be
Yeah.
muscular, and some of your worth is derived by how much you can bench or lift in that point.
Yeah. Yeah.
Yeah.
Yeah. And I think that's a perfect example. And I feel like
Mm,
going back to more the thin ideal side of things, I think of
mm,
what is broadly diet culture that we live in.
right.
This
Yeah.
notion of kind of talking about and even bragging at times like, oh, yes, I started this new diet, right? And throughout the past decades, we can see examples of what those diets were
Yeah.
that intersects very much with the use of weight loss drugs as well. And just, I think I feel comfortable saying this obsession almost around what
Yeah.
our bodies should look like in a way that, again, is just so pervasive and subtle or insidious in a way that is
Right.
just constantly surround us.
Yeah.
Yeah.
Yeah, I appreciate that point because I think, sometimes even for myself, I have a little bit of this cognitive dissonance around where I realize like what society deems as acceptable or attractive or what it pushes us towards versus what I actually think and care about, which is, everybody should be happy and comfortable in their own bodies.
Hmm.
And there's that a little bit of that push and pull where you have to like really be conscientious about how you're thinking about it, and how you're
Hmm.
approaching it with friends and family and yourself too, when you
Yeah.
look in the mirror.
Yeah.
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 There were a few words that I think I mentioned in the intro that I do want to take a second to just define for our audience, so we're not losing them in the dust. But first one that comes to mind is objectification.
Mm.
I know this is becoming a little bit more common in, I think, the lexicon, but just in case anybody's not exactly sure what we're talking about, do you mind just quickly defining, the theory of objectification or the concept of it?
Yeah, for sure.
Yeah.
For objectification, I would focus on the first part of the word of object, right?
Mm,
So objectification, especially as it relates to body image, is this notion of internalizing these different body ideals that we've been talking about, and really ultimately viewing oneself as just purely an object,
mm,
and not a person with feelings and interests and attitudes, but really reducing someone just to their physical appearance, just like you
right.
would to describing an object's physical structure.
Right.
And objectification really stems into other forms of being sexually objectified in
Mm,
terms of being seen
mm,
as just a sexual object, or it can
right.
sit again just with appearance as an appearance based object.
Right.
Yeah.
And how does that tie into some of the body image research, discourse findings? I would imagine
Yeah.
comes out with some negative effects on how people view
I
themselves.
as
Yeah.
for you would be correct for sure,
Yeah.
unfortunately.
Mhm.
I do wanna pay acknowledgement that objectification as a theory really was rooted in recognizing what I would just broadly, describe as falling under just this one example of many of sexism in our
Mm,
society towards women.
mhm,
So, objectification theory, and to your question of how this ultimately has a really harmful impact, this process of being viewed as an object by other people, you're not a woman, you are just an object for me to
right.
view. That at some point, understandably, that gets internalized by
Mm,
someone where I just start thinking, you know what, maybe people are right. Like maybe I am
mm,
just an object to be looked at or to be used. From there, what we commonly see happening then are these different processes related to body image, such as behaviors like constantly checking your body. So
mm,
constantly checking your body in the mirror, checking how your clothes fit before you go outside. This further then leads into just an internalized feeling around shame all about your body,
mm,
feeling like I'm not a good enough person because of XYZ thing about
mhm,
my body. And then very specifically, what we commonly see happening is all of that ultimately can lead to some really harmful mental health outcomes. Of course, eating disorders, doing
mhm,
things to change your body, like restricting your
right.
food or purging on food that we see in
Mm,
disorders like anorexia and bulimia. But I would also note that this can lead to other types of mental health too that aren't necessarily just eating disorders. As you might suspect, this can lead to feelings of depression. This can
right.
lead to different types of anxiety, social anxiety, a generalized anxiety, and can just have a whole host of different really harmful negative effects as a result of this objectification.
Yeah, I appreciate that, and there's a couple points in there that I wanna get to, in a little bit, but I wanna just take a tiny pivot to, this concept that you specifically study, which is minority stress,
Hmm.
when it comes to body image. Do you mind just speaking a little bit to that, what that concept is,
Yeah.
and how you research it?
Certainly, yeah. So
Yeah.
the minority stress in the context in which I do research on the topic is, as I was mentioning earlier, and as you mentioned too, related to LGBTQ related identities. And so at
Mhm,
the broadest level, minority stress as a theory was really put forward to try to explain why we're seeing these higher rates of not just mental health concerns, but all types of detrimental health concerns in
mhm,
LGBTQ populations. And so, what the theory would suggest is that these I'm going to describe them as interpersonal forms of stigma. So, think
mhm,
of being discriminated against for your LGBTQ identity, being victimized or the victim of hate crimes because of
mhm,
your LGBTQ identity. And even at a structural level, different LGBTQ legislation and
right,
laws, all of that falls into these interpersonal forms or structural forms of stigma. So these are things that individuals who are not LGBTQ don't face in their lives. And that's not to say that heterosexual and cisgender folks do not, face struggles of their own, of course, but
sure,
these stigma-related struggles are not present. And so what
right.
stress theory would say
Unique
is that
areas of stress.
yeah,
Yeah,
yeah, for
yeah,
sure. And so anyway, those that discrimination and those other examples, what we see based on this theory is that that can also lead to these internalized feelings that LGBTQ people have negatively about themselves,
mm,
of feeling that they're going to be rejected, feeling that life would be easier if they weren't
mm,
LGBTQ, and it's those internalized processes then that ultimately then lead to depression, anxiety, eating
mhm,
disorders, and in my case, body image related concerns
mhm.
that otherwise stem from those factors that are not applicable to non-LGBTQ individuals.
Gotcha. Thank you for defining that. I appreciate that.
Yeah, sure.
How does that interplay with or differentiate from intra-minority community stress?
Yeah, yeah, that's a great question. So, minority stress is something that we've talked about now for decades, right?
Mhm,
It's only maybe more recently been formalized, but we certainly have recognized these minority stress factors for decades. But intra minority stress is
mhm,
more of a newer theory, at least
mhm,
formally, a newer theory,
mhm,
and is really much more so getting at what's happening from within the
mhm.
community as opposed to outside the community.
Gotcha.
When I'm working with clients in psychotherapy, when intra-minority stressors seem to be playing a role, sometimes I describe it as if minority stressors are the things happening from outside of your identity,
Mhm,
things that are, again, working against you for being an LGBTQ person.
mhm.
Intra-minority stress is really getting at stressors that are stemming from within the community,
Gotcha.
internal within group conflicts, if you will. And so, yeah, yeah.
Got you. So then how does intra-minority community stress come up with body image in the populations that you research?
Yep.
Yeah.
So the most work that's been done on intra-minority gay community stress with body image has very much been specifically with gay and bisexual men.
Mm,
I might broadly describe said group as sexual minority men broadly.
sure.
And so what we see from intra-minority stress research is that within the group of gay
Mm,
and bisexual men, there is, of course, its own culture, and very much a culture that at times perpetuates these body image ideals that
mm,
can lead to conflict between gay and bisexual men who are
mm,
not achieving those ideals. So to be
gotcha.
very concrete,
Sure.
having this what sometimes referred to as this muscular but lean
Mhm,
ideal.
mhm.
The technical term is a mesomorphic body image
Gotcha.
ideal. Think a like swimmer type build, right?
Right.
Where that is the type of ideal that is put on a pedestal, if you will,
Mm,
within the community of gay and bisexual men. Uh, Also having aspects like an athletic build is also a piece of this too, and there's certainly a piece of intersectionality here when looking
mm,
at race and ethnicity,
mm,
where among gay and bisexual men, there seems to be this sometimes objectification around one's race and this focus sometimes on body ideals that really prize white bodies or white
mm.
presenting bodies. And
Right.
so all of this in you name the community setting, right, can lead to just this form of competition,
Right.
and sometimes of just not feeling good enough about one's
Mm,
body, which subsequently, of course, then leads to feelings of body dissatisfaction and
mm,
sometimes
mhm.
even, I would say, even more severe outcomes like eating disorders or other types of mental health concerns.
Got you. Thank you. I appreciate that. And you
Yeah.
you got ahead of me there. I wanted to ask about, the disordered eating and body dissatisfaction in the community. In the sort of broader context of body image, if you kind of had to ballpark, what do you think the rates are of body dissatisfaction these days? Like, is there a trend upwards? Are we getting better? Are there any specific things that are exacerbating it?
Yeah, yeah, yeah. Oh gosh, that's another great question. And unfortunately, I don't have a optimistic response.
Sure.
So, I'll preface by saying that it's common in the field that you hear body image dissatisfaction described as this normative discontent or
Mm,
this normal discontent is a phrase that has been thrown around for decades now, really
mhm,
speaking to this notion that body dissatisfaction is constantly there and has
mm.
always been there. It looking like in face-to-face conversations, people never feeling satisfied, or at least not fully with their
So is
bodies
the
in
I
that
is
way.
the is more I guess more general just for my understanding in the
Yeah.
audience, is this idea then that, this being normalized or at least this push to be normalized is that
Mhm.
we've never as a species been satisfied with our bodies since as far back as, you know
E
Yeah.
I yeah, yeah, yeah.
Mm,
I think, I think a big piece of where this normative discontent or this just normalcy of most people, if not arguably all people, not
mm,
liking fully or at least parts of their body, I think very much stems within the past couple of decades when you saw the rise of mass media,
gotcha.
be it initially of, hard paper magazines, really
Mhm,
prizing different body images. We saw this, of course, with the rise of movies and TV shows, of course, that
right.
prized people of different body sizes. And
Yeah.
now, not just 2025, but for the past, what, 2 decades or so, however long social media has been
Yeah.
around, social media has certainly played or added to a potential contributor as to what
Gotcha.
might make people feel dissatisfied with their bodies. And so, but to your direct question of rates, I don't know if we have, specific population-based data that would speak to yes
Sure.
across like the US this is
Yeah.
what we see. Different studies will tell you different percentages, of course,
Yeah.
but I do feel comfortable saying that it certainly is high,
Yeah.
and that I don't know if it's any higher than when
Mm,
it's been, but
mhm.
I feel comfortable saying it certainly has not decreased
Got it.
in recent times. Yeah.
Yeah, and I think with, the prevalence of more with stronger beauty standards, as
Mhm.
social media increases and really highlighting, quote unquote, these prized bodies in media, I think
Yeah.
goes back to the point that you made of all these negative outcomes that are what's really most important about
Mhm.
studying body image, and why I think, um, and a lot of what your research focuses on is making sure that people understand that this is, while it may be normative, there are negative outcomes that we need to focus on, right?
Yes.
It's
Yes.
just because it's normative doesn't mean it's good.
Mhm.
Yeah,
For sure. I will
yeah,
just say too,
sure,
from the research side of things, and I'll speak for myself where
sure.
I think part of this normalcy around body dissatisfaction has also been furthered by our research questions that we've asked. I think
Mm,
as researchers, we have just assumed at times that people are dissatisfied with their bodies. And while there is certainly truth to that in many contexts, within the past decade, we have definitely seen a rise in more of this positive body image
mm,
movement and
mhm,
recognizing that there are really strong notable efforts that folks are really putting forward to combat a lot of these really unhelpful body image ideals and to find recognition of feeling feeling positive and comfortable in one's body, or
mhm,
at feeling, or at least just feeling neutral in one's body,
gotcha.
and not necessary, and really trying to engage in ways to not internalize these messages from society that I should look this certain way. And so,
Yeah,
credit to positive body image movements that I think within the past decade very much have really tried to call out, maybe sometimes the overfocus on
mm,
body dissatisfaction, and
mhm,
recognize that there is something to be said of really embracing and loving our bodies of all sizes, of all colors, of all
yeah.
ability statuses. Yeah, yeah.
Yeah, I appreciate you bringing that up because one of the things that I am really curious about, and kind of going a little bit back to what we were talking about on intra-community dynamics,
Mhm,
is this idea of community connectedness,
mhm.
and I love to hear a little bit, from your perspective. How does community connectedness play a role? What is community connectiveness? And I know that it's noted in your research as a protective factor, and so if you could just for our audience, like, what is it? What does that mean?
Yeah.
Yeah.
Yeah, yeah, for sure. I I'll start by making a distinction that I hopefully is helpful between community connectedness or connection
Mhm.
and and community involvement
Mm.
that folks might
Mhm.
have. So the
Yeah.
focus that my research focuses on is very much the former, this connectedness piece. And
Mhm.
community connectedness is really getting at this sense of belonging, this feeling that I belong
Mhm.
within in what I study, this LGBTQ community. And that might overlap with getting involved in doing things in the community, but not necessarily, right?
Gotcha.
Whereas the community involvement piece is, to what extent am I engaging in nightlife or in
Mm.
advocacy and things like that.
Mhm.
So with that distinction, yeah, with community connectedness, what I'm really finding in the research that I'm conducting is, and very much pulling from just broader mental health LGBTQ research, is that if we can potentially tap into this sense of belongingness among
Mhm.
LGBTQ individuals, that in some ways can maybe buffer or protect
Hmm.
against uh, various mental health concerns, but including eating disorders and disordered eating.
Gotcha.
Having this sense of belonging and having a sense of connection with other people from your community who, presumably might also struggle with body image as well. And to
Right.
have that close knit group of other queer trans people that you can talk to, and to call out these messages and
Yeah.
these, really harmful ideals and stuff, seems to be a way to potentially protect against disordered eating.
Oh, awesome. Yeah, I think, d you know, community connectedness is big in the mental health field overall, but
Hmm.
I think it's important to talk about it in terms of body image, and it's great that there's some positive findings around it. Are there any tips that you have for anybody listening to this on who maybe is like, "Oh, I'm realizing right now as I'm listening to Zach that maybe I'm not as connected as I could be. Maybe I
Hmm.
am just participating."
Yeah,
Yeah.
right. For sure. I one thing that comes to mind for me is I think one just really reflecting on uh, any social supports and friends in your network right now, just really reflecting on kind of what the dialogue looks like between you and those friends, those supports that you have right now, around body image and around this topic, right?
Right.
And of course, this will vary person to person, but as you're comfortable within these relationships, bringing up this topic with
Mhm.
friends of like, I know that we talk a lot about, gosh, I shouldn't have eaten all that food because it's going to impact my body in this way, or I'm a bad person because I haven't gone to the gym for a week.
Yeah.
Of just gently bringing that up to your friends and folks that you're already connected with, to really question that together. Of you know, is this something really helpful for us to engage in? I'm finding that personally, it really doesn't make me feel really good about myself,
Mm.
and I don't know if my whole self worth is. I want it to be totally based around my body and my physical appearance. Again, different friend groups are maybe going to be more amenable to that or not, but I
Right.
would I would broach that with, or I would suggest that to some folks potentially as a one route to just plant that seed in the
Yeah.
folks that you're already connected with as something at minimum, just for them to think about.
Yeah. Baby steps.
Yeah,
Yeah.
for
Yeah.
sure. Yep. Yeah, yeah,
Yeah.
yeah,
Cool.
for
Yeah. I
sure.
appreciate that. Um, you mentioned intersectionality
Mhm,
earlier. Are there any aspects of intersectionality that you think broadly shape the experience of body image within LGBTQ plus groups?
mhm. Yeah, yeah. Uh Yeah, all of it. Right, I think all of the things. I
Yeah.
think intersectionality is the rule and not the exception. It's
Mm.
just that, I think some disciplines are just catching up now to recognizing
Right.
intersectionality in that way. Um, but no, I think more specifically, we're seeing some really exciting research right now
Mm.
that is looking at the intersection of, LGBTQ identities, with
Mm.
race and
Mm.
ethnicity.
Mm.
We're also finding a lot of seeing a lot of research that's looking at the intersection of identities specifically related to ability status that
Mm.
folks have and how
Mhm.
that has an effect on body image. Um, Seeing nice intersections with the neurodiversity movement as well, especially within
Awesome.
my LGBTQ field. Uh,
Mhm.
if it's helpful for folks, just to give a quick concrete example, going back to
Yeah.
thinking about the intersection of race, ethnicity, and LGBTQ identities, there was a study that I conducted and published a few years ago that looked at a sample of predominantly sexual minority men, who were all Black or Latina.
Mm.
And the study looked at a lot of things, but one of them was specifically looking at the body image concerns among these
Mm.
Black and Latinx gay and bisexual men. And in doing so, we also looked at the former topic of community connection. And
Mm.
interestingly, we found, as you might suspect, that the higher level of LGBTQ community connection that these individuals reported, the lower levels of body image concerns that they
Mm.
reported. Makes
Yeah.
sense. But what I think was a little bit more novel was when also looking at racial and ethnic community
Mhm.
connection and looking at how that type of connection intersects with
Mm.
LGBTQ connection, that the Black and Latina sexual minority men who had the lowest levels of body image concerns were those that endorse both the high levels of LGBTQ connection
Mm.
and racial ethnic connection,
Wow.
which to me just really speaks again to for those individuals in that study, but just for
Right.
anyone who carries multiply minoritized identities,
Yeah.
that this is just the reality, right? And I
Yeah.
think we're finally as a field recognizing that a lot more, and so I'm excited to see where more intersectionality research goes, and I'm hopeful that at some point it becomes even just the norm, where
Yeah.
we don't even call it that because we are just
Right.
approaching all type of research in that way.
Absolutely. Yeah, moving away from these weird populations more towards the,
Yes, yes, yes,
diverse,
yes,
globalized populations, which
absolutely,
should be the standard. I
absolutely.
appreciate you bringing up the study that you conducted. Do you think that there are any specific subgroups within the LGBTQ plus community or any other intersectional identities that
Yeah.
you think research needs to be focusing on more, or more resources need to be provided to because they're sort of at the bottom rung right now of attention?
100%. The
Yeah.
so within the LGBTQ community,
Mm.
there absolutely needs to be more research conducted conducted on and with trans and non-binary individuals and other folks who are gender diverse. Uh, I'll even call myself out that within our talk so far, I've used
Yeah,
the acronym as we commonly do LGBTQ broadly, and LGBTQ identities are not a monolith. They're not
right.
all, we're not all one of the same group, and
Yeah.
that particularly is the case for folks who identify as trans, non-binary, or gender diverse. So much of the body image literature has been on the LGBTQ part of the
Mm,
acronym. And to be fair, more of
mhm,
just the G part
mm,
among gay
right.
men. We certainly need more work among lesbian and bisexual women as well. But absolutely, especially in these current times where I feel like there's a lot of targets that are being put on the backs of trans and non-binary individuals.
Mm,
We certainly need more research to better understand what the body image experiences are of said subpopulation as it relates to a whole host of different outcomes, mental
yeah.
health wise, just overall well being. But yes, definitely trans and gender diverse populations need so much more focus and recognition.
Awesome. Thank you. So, if you're a student listening to this right now, we just
Hmm.
gave you a dozen plus thesis topics. Yeah. Yes.
Right.
Yeah.
Take notes.
Please, please go. We need the
Yes.
research.
Yes.
um, so I want to pivot just slightly to
Sure.
clinical practice on the
Mhm,
same topic, but thinking about clinicians and anybody working clinically who's listening to this. Is there anything that clinicians can do, especially when they're not from any of these identity backgrounds or communities, that they can
mhm.
do to be better resourced for supporting and helping these communities?
Yeah, for sure. Uh, two things come to mind for me.
Hmm.
One, as it pertains to sexual and gender identities, folks in the LGBTQ community. I think one thing that clinicians can do, especially folks who identify not as part of the community, are I think a nice first step is just seeing what your LGBTQ clients are going to interface with before they even walk into your office door.
Hmm.
What does your intake paperwork look like? Does it have it probably does have gender listed, but when it does it have a range of gender identities that are
Hmm.
inclusive for trans and non
Hmm.
binary folks? When it comes to sexual orientation, if that's something that is asked, um, is that something that you, as a heterosexual mental health provider, are recognizing that, oh gosh, I might have a bias there where, as someone who's heterosexual, I might just assume that my a cisgender man client is with a
Hmm.
cisgender woman as a
Hmm.
partner. And
Right.
so once your clients walk in through the door, then, during your initial intake and initial appointments, asking questions, getting to know your client that are inclusive of said identities.
Okay.
So asking about romantic partners broadly, using that type
Okay.
of language versus using assumed gendered language as
Awesome.
well. And then I also would just say for clinicians too, especially clinicians who might work with clients with body image concerns, is thinking about what is the structure, the literal physical structure of your practice.
Hmm.
For clients who maybe are larger bodied, is
Hmm.
your practice structured in a way where they can navigate your practice in a feasible way,
Hmm.
all the way into
Hmm.
your office. What
Right.
I've had so many clients who have told me, larger bodied clients who have told me that when they come into my office and there's a chair that they can fit in, that this is one of the first times they've seen a
Oh,
mental health provider with a chair that they can fit in.
yeah.
Um, and that is something that should just be common practice across
Absolutely.
the board. And so I think a lot of what might seem like small things
Hmm.
can are things that are very much within our control as
Hmm.
therapists and clinicians
Hmm.
and can make a whole world of a difference for
Yeah.
set clients.
Yeah, I appreciate that. Thank you. And yeah, I think everything that you just listed is something that, for any clinician or practice that's listening right now could probably, fix over the weekend, right? And
Sure,
get in alignment.
sure.
Yeah. Yeah. Yeah.
Yeah.
Cool. Thank you. So I want to stay on this topic of,
Mhm,
clinical and, educational orientation to what we're talking
mhm,
about. Do you think there's any misconceptions in treating
mhm,
body image, and maybe what are some of the biggest ones that any clinician should be aware of? And
mhm,
while you're thinking about that, I just want to share. We have a clinical practice here in California, and we get people who come in with body image concerns, eating order concerns, and even here in Southern California, there are few and far between practices that specialize in it, or that are accessible. And so I think, this conversation that we're having is important for any clinician who is not specialized in it, because they probably will end up with a client at some point with it and maybe not be able to send them to some alternative resource because it may not be available where they are.
Yeah. Yeah.
Um, yeah, so kind of coming back to it, sorry, I went down a small,
No.
rabbit hole there. Yeah, biggest misconceptions, in
Yeah.
treating body image that you think,
Yeah.
exist right now? Yeah.
Yeah. That's a great question. I lots of things come to mind, obviously, but I think one or maybe two, but one
Yeah,
definitely that comes to mind first is this notion that when you're working with a client who broadly has body image related concerns, whatever that looks like, I think sometimes a misconception that clinicians can take is that the goal is going to be for those concerns to go away
mm,
completely. Or, said differently, the goal is to encourage clients to embrace this notion of body positivity or
mm,
positive body image. And I would just caution clinicians to automatically go that route because for some individuals, especially for folks living in larger bodies who have been told their whole lives that they're not good enough because of their body size, quite frankly, the notion of loving and embracing and respecting your body may be a nearly impossible goal to achieve.
right,
And so all this comes back then to what I know that listeners already know, but I'll say it anyway, is really just listening to your client and what it is that
mm,
they're looking for here.
mm,
And don't get me wrong, sometimes clients might come in with this notion of, yes, like I want to have no body dissatisfaction at all and love my body. And of course, we as clinicians want to work with our clients to strive for that. But I think it's also part of our role as clinicians too to provide other alternative outcomes as well, and to not sometimes pigeonhole clients into achieving, like I was saying, for some that just may not be feasible.
mm.
But yeah, I think to me that's the biggest misconception around goals of treatment.
Awesome, I appreciate that. I don't think, I have yet to hear that perspective, so and it's kind of
Mm,
refreshing, and so I do
yeah,
appreciate you sharing that, yeah.
yeah.
Um, in in implementation science of taking, this research
Mm,
and making it usable, for clinicians,
yeah.
um, in LGBTQ plus affirmative training, what does that really look like for those who aren't familiar with it? And where do you think clinicians are still sort of getting things wrong when it comes to LGBTQ plus affirmative care?
Mhm. Yeah, yeah. Hmm.
I know, big question that I just threw at you.
Right,
Sorry.
right.
Yeah.
No, no, no.
Yeah.
It means it's a good one, right?
Yeah.
No, no, no. Can you actually repeat the question? I wanna make sure I
Absolutely, yeah.
answered it for
See,
you.
absolutely, yeah. So the first part is, LGBTQ plus affirmative training,
Mhm.
because I know that's part of a little bit of what you do as well.
Yes.
One, what does that look like? And then
Got it.
two, for clinicians, who may be trained in it or maybe think that they are an
Yeah,
LGBTQ
yeah.
plus affirming clinician, what do you think they're getting wrong, or what do you see as some of the missteps that tend to be common?
Yes. Yeah, yeah.
Yeah.
Yeah, no, thanks for repeating that. I think
Mm,
to your first point when it comes to
mm,
LGBTQ affirmative training, so
mm,
my colleagues and I published a paper just a year or so ago in the Journal of Cognitive Behavioral Practice, which more or less addresses your first point of
mm,
what can LGBTQ affirmative clinical work and then translate into training and said clinical work. What can that look like? For sake of time, I won't get into all the details, but what the paper puts forward are six broad principles that,
mm,
regardless of your clinical approach, your theoretic orientation, is something that we feel can be beneficial across all types of LGBTQ
mm,
affirmative care. And one of those principles that really resonates here to me is this principle of recognizing that the mental health or body image or whatever related concerns that your
mhm,
LGBTQ client has is very understandable.
Mm.
given the context of what is LGBTQ related stigma that said individual has faced throughout their entire
Right.
life. And you can pull in some of the intra-minority community stuff in there too.
Mm.
And what this looks like in praxis then is literally sometimes saying to clients, this has been so challenging for you, and I guess I'm not surprised that you're facing this right now,
Mhm.
given all of the things.
Right.
Uh, One of the building off principles from that, though, is to then emphasize how we know from decades of LGBTQ community resistance that LGBTQ individuals and the community as a whole is very equipped with fighting back against these challenges that
Mm.
are being faced. And to call that out in a positive way, of course,
Yeah.
in therapy with clients can be really notable for some individuals who feel like there's nothing that they can do to change
Mm.
what they're struggling with. And so so shout out to, I guess, shout out to that
Yeah.
paper to check that
Right.
out if folks are interested. But then briefly to your second point about maybe where sometimes clinicians are unintentionally, having missteps or going wrong.
Mm.
The biggest truly unintentional misstep that I see is where, and so many folks do it, is sometimes we conflate or we misinterpret what are the challenges that an LGBTQ person has around body image or any concern. We we attach that to the identity itself that they
Mm.
carry and not to the actual stigma related factors that cause it in the first
Mm.
place. And so to be concrete with this,
Yeah.
something that I try to be really cognizant about in my own writing is that we don't want to say that LGBTQ people, because of their LGBTQ identities, have worse body image related concerns. It would be more accurate to say, because of various forms of stigma faced
Mm.
by LGBTQ people, we see higher rates of body image concerns as a result
Gotcha.
of said stigma. And so just little kind of might seem nuanced, but again, things in my own practice that I see really can make a world of difference to our clients who clinicians know are definitely listening,
Yeah.
that clients will really, I think, appreciate what might seem subtle, but can be a really impactful change in how you, as a clinician, conceptualize their body image or otherwise related concerns.
I appreciate you delineating that. I agree. It is nuanced, but I think, now that you've said it, given the example, I can see it more clearly of what that differentiation looks like.
Yeah.
So I do appreciate that. I want to make sure that we have time to kind of talk about media. And how
Yes.
big of an impact media has on everything, but especially body image and identity. So I
Mhm.
you know, I my understanding is a
Yeah.
little bit more limited than yours, but I know that social media plays a really big role right now, especially with younger generations, in
Mhm.
how body norms are shaped.
Mhm.
So has either of your work, whether it's been research or clinical, have you noticed any specific patterns in the effects of social media on body image?
Mhm. Yes, I feel where I have seen it the most is in my clinical practice.
Mm,
My own personal research doesn't focus as much on the effects of
sure.
social media, but I have certainly seen it in clinical practice. And the way that I've
Mm,
seen it is certainly in across all age groups
mm,
developmentally, but as listeners probably can guess, very much within adolescent and young adult
mm,
populations. And
mhm,
honestly, I guarantee you probably see it in children too. I'm just not a child
mm,
psychologist, so I don't work
right,
with kids.
right,
But certainly within teens and young adults, and you're seeing it in the way where uh, I individuals are just we are just flooded nowadays
yeah,
with whatever you name the platform. And now at a time where, we have, I'll say evolved, I guess, where we've evolved from just static pictures, right?
right,
To now live related short
yeah,
blips that you can just be constantly flooded by, which can just maybe not maybe, can send a message and lead to you as a young person internalizing, why does it my body look that way? What
right,
am I doing wrong that I don't have a body like that?
mm,
Um, and just as youth are impressionable in so many ways, I think this is so much the case when it comes to body image.
Yeah, I appreciate that. Do you think, in this dis discussion and what's being pushed on us around body standards today, do you think that
Mhm.
there's been a change in body standards over time?
Mm,
Or maybe certain pressures around, body image and body standards that have become either more entrenched or maybe even, less
mhm.
entrenched recently?
Yeah, yeah,
Yeah.
yeah, yeah. It's hard for me to say to that.
Mm,
Part of my initial response or thought that I had when you had asked that question was that yes, I do feel there has been changes for the better in
mm,
the sense of I do feel like now compared to the early 2000s, I do feel like there is more of a voice of fat activists and folks in larger
mm,
bodies really calling out what are unhelpful standards when it comes to
mm.
diet culture and other body image ideals. Uh, I want to give credit to said folks because said folks have always existed. It's just that I think that we're
Right,
not listening. So,
right.
in some ways, yes, I do feel like things have changed for the better in that way.
Mm,
And with this just normalcy of social media, as we were just talking about, I can't help but wonder, not just as a researcher and clinician, but just as a person, of
mm,
just like how is this having an impact on especially youth and young people, um, and worried that to your question, I don't know if the ideals are necessarily changing, have
mm.
necessarily changed per se. Um, but I do think that there are certain factors that might exacerbate those ideals more
Gotcha.
than others now. Yeah,
Yeah, and
yeah,
that constant exposure all day, every day, and like you said, moving from still imagery and in media and advertising to short form video content,
yeah,
probably does exacerbate that. So,
yeah,
and I wanna take this idea and connect it back to what we were talking about earlier around protective factors or this idea of resilience.
yeah.
Um, What role do you think resilience plays in improving body image outcomes, either for the individual or even for a community, like we were talking about?
Mhm. Yeah, I think it can play an important role for sure,
Mm,
and I think resilience a few things. I think
mhm,
resilience can come in various forms, right?
mhm,
So I think depending who you are, sometimes when you think about resilience, we commonly think of it, I think, as an individual factor.
mm,
How can I be resilient? How can I push back against these unhelpful body image ideals, stuff like that? But resilience can also play into what we were talking about earlier around
mm,
community level
mm,
resilience as well. And so I do think, and we have certainly seen this broadly in the positive psych movement, of
mm,
really leaning into not just what makes things go awry for folks, but also what can help folks as well.
mm,
And so I do think that resilience in those ways, be it in psychotherapy that you receive or just be it in your own self-care, can be a way to challenge some of those body image concerns.
mm.
But if I may, I will say to that point of resilience,
Yeah.
I and I think this really comes to mind for me of working with minoritized folks, specifically LGBTQ individuals, is
Mm,
that resilience should not necessarily be the onus of the person, right?
right.
And that ultimately, as related to body image, this is so much more a systemic related challenge. Uh,
Absolutely.
Reference to diet culture, reference to those Western based ideals
Yeah.
of body image and attractiveness. Uh, I don't know if I have like the magic wand solution of how that goes
Sure.
away, but I can say with confidence that this
Yeah.
is very much something that is systemic. So, to whatever extent that resilience or change can be present at a macro or system level,
Mm.
that is something I do feel really strongly needs to be addressed in addition to these individual or community level factors as well.
Cool. I appreciate that. I think, and we haven't touched on it broadly how this is a systemic issue, right?
Mhm.
This is so deeply entrenched in our society, in our culture, and I do have a couple questions around that. But just before we pivot to that, I want to just see: do you know of any like community interventions, grassroots interventions, anything that you see that has been helpful in these populations for helping support a healthier body image, or building this sort of community resilience?
Yeah, yeah. Uh, I do. So one thing that comes to mind related to my LGBTQ work, uh, gosh, I don't remember the exact year it happened. It was a few years ago now. So the popular dating app Grinder that
Mhm.
exists. Back in the day, I sound so old when I say that. So back in the day, you could choose a lot of different you could choose a lot of different categories and a lot of different so-called preferences on
Mhm.
Grinder. This that on this queer dating app. And I know that a few years ago, Grindr put forward, I want to say it was a campaign, this kinder Grinder
Mm.
campaign that really did away with a lot of those preference related check the boxes of not looking for folks of larger bodies, not looking
Mm.
for individuals who were racially minoritized folks. And to my knowledge, they have removed all of those types of features, which were problematic for many reasons, but
Right.
including for body image and very much tying it back to what we talked about earlier in this episode around objectification, of
Yeah.
really taking away what was frankly objectifying someone based on the color of their skin, the size of their body. And
Yeah.
so that's one example from a program system-wide change that I have seen that I think and I hope, I don't know if there's data to support it, but hope that has been beneficial.
Yeah, and hopefully other dating apps can take a lesson there,
Yeah.
that have those types of filters on, and can
Yeah.
create a healthier dating system for everyone.
Yeah.
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 Um, I want to talk about sort of big picture since we're now talking about some of these systemic things here. Do you
Mhm.
think that there is any broad misconceptions that the general public has around body image that you'd like to kind of
Mm.
challenge our listeners on, challenge society on? Um,
Mhm.
yeah.
Yeah. So many. So many, so many, but we don't have all the time. Uh, I'll I'll there's 2 that are coming to mind. The first one is pretty brief and I think pretty easy to check ourselves on. I
Yeah.
think we often overlap too much body image with eating disorders. And
Hmm.
while there are certainly parallels, or there certainly is
Sure.
overlap there, I feel like there sometimes is this assumption that, oh, someone doesn't like their body, oh, they must have an eating disorder.
Hmm.
And I see this coming about in ways that are ultimately just really unhelpful for everyone involved. And so I see this a lot in the research field, where I think in research we have done a really nice job more recently of recognizing that body image is something that is certainly associated with eating disorders, no doubt, and is its own focus in and of itself, based on how it's related to so many other things. Um, so that's the first more brief, quick thing. The second thing, which is a little bit deeper and certainly challenging, and
Hmm.
just to be a little humble, something that I need to work on constantly in myself too, is I guess I would just put a call out there for us in society to. There's this misconception that it's okay for us to so freely comment on other people's
Hmm.
bodies. I if I can give, like, a specific example, I'm
Sure.
just hearing a lot of dialogue right now around the Wicked for Good movie
Hmm.
and the body
Yeah.
images of Ariana Grande and Cynthia Erivo, and I could go on a whole thing about that, but it also
Sure.
comes down to, it's just very interesting that we so freely feel like we have the right to talk about how thin someone is, or how not thin someone is, or
Right.
how big someone is, or how not big someone is. And as hopefully has been, conveyed on this episode,
Hmm.
body image is something that is so intertwined with who we are as people, and so for society and individuals to call that out to any person, I
Hmm.
I just think it's something I would love to see us as a society being a little bit more mindful of, and just really sitting with, is it really in my place to comment on this person's body. And to be clear too,
Right.
I gave like a celebrity example. This happens among friends and family. Comments
Absolutely.
like, "You look so thin. Have
Yeah.
you gained some weight?" And we say
Yeah.
these things right after talking about the weather, right?
Yeah.
Like, it's just these very commonplace things, and I just think that is a misconception that it's okay for us to do that, when
Mhm.
for a whole host of reasons, I actually feel like it can be really problematic and, at worst, harmful for individuals to do that.
I appreciate you mentioning that. As you were saying it, I was thinking back to all of the times that I've sort of done it without thinking about it. I see a friend, I'm like, oh, you've lost some weight, you've been hitting
Yep.
the gym, or whatever it may be. And I think you're absolutely right. Like, what is my place in commenting on somebody else's body and their journey and their identity
Mhm.
in that way? Because I wouldn't do that about any other aspect of their identity.
Yeah.
And so why do it about their body?
Yeah.
And so, yeah, I
Yeah.
really appreciate you
Yeah.
making, I think, not just myself, but hopefully our listeners a little bit more conscientious in how
Yeah.
we approach that, going forward.
Yeah.
Um, is
It's
there
something that I
anything?
do.
Yeah,
Oh,
yeah.
so I was just gonna
Oh,
say real quick,
yeah,
it's
please.
something that I certainly am guilty of too, even in this
Mm,
present day, and I had to catch myself in doing that,
yeah.
and if I may, I think,
Mm,
when I've had these conversations in teaching settings and just in informal settings, I think a really fair response that people will give back to me is something like, but it's coming from a good place.
mhm,
I'm complimenting that I think someone, looks really attractive or is just, looking really nice, right?
mhm,
And of course there's nothing wrong
sure.
with, complimenting someone in that way. I think what it comes down to is really sitting with, before saying it, would I say this in other contexts if they did not look like they've lost weight? If it did
Mm,
not look like they are, becoming more muscular, and
right.
maybe thinking twice before commenting if the reason is stemming more from these really body weight focused things, as opposed to what could just be like, I think you look really great in that outfit, or you look really pretty today. And so
Mhm,
I think that's such a fair counter or question that folks
mhm,
will bring up to me about that. And so I certainly just want to emphasize that the message by no means to not lift and to compliment your friends and your loved ones, or,
absolutely.
or folks in that way,
Yeah.
but just doing just a quick check of as to maybe what you're saying and why you're saying it beforehand.
Yeah, what immediately came to mind for me is this idea of projecting body standards, right? What we think our body standards are onto
Yep.
somebody else, and I like that I like that idea of a check with a question like that because there are absolutely better and other ways to compliment those around us that we care about
Yeah.
that don't take part in this projection of body standards.
For
Yeah,
sure.
thank you for
Yeah, for
that.
sure. Yeah, of course.
Yeah. Um, do you think that there's any areas that the research in body image is overlooking,
Mm,
or should be like the next area that the research needs to go when it comes to body image?
yeah, yeah. Again, so many. So, so many. Um, One of them I can briefly say because we've talked about it. I There
Sure.
needs to intersectionality as an approach, it needs to be more the norm than just the
Mm,
exception, right?
mhm,
So I just want to give that other plug of recognizing that we as all human beings have intersecting identities, and those intersections have unique impacts on our body image. And so what that looks like in practice is really diversifying and broadening the populations that we're studying,
mm,
namely branching out beyond able-bodied, white, cisgender, heterosexual populations.
right,
So more of an intersectional focus is one. I think kind of the next direction, which is a little bit more niched, but is I think maybe not discussed as much, is a lot of our body image research to date has been mostly cross sectional. And so what we mean by
mm,
that is, uh, if anyone listening here has ever taken like that one survey and then that was it,
mm,
that's cross-sectional, where people
yeah,
ask you a bunch of questions in that like one moment, and then there's results that come about from that. And while there's certainly benefit in cross-sectional work, I myself have done a lot of cross-sectional work, it really doesn't speak to the long-term effects of what body
mm,
image looks like. So from a developmental standpoint, when you survey someone at the age of 22, that's great, but what happens when they're 30? and then
Yeah.
40, right? So looking at those longer term effects and what we might refer to as longitudinal
Mhm.
research, I think is a way to go. And then relatedly to that, we don't even need to focus on years of development, but even just looking at more of the micro longitudinal, kind of the day-to-day differences that we see in body image.
Hmm.
There is a nice literature that has looked at state-based body image. So
Hmm.
how do I feel today in this moment right now about my body versus how I felt yesterday at this
Hmm.
time? And there
Yeah.
are some really cool, fancy research type approaches that you can do to get at more of those day-to-day fluctuations in body image. But yeah, I personally would love to see even more research, and I think the field would agree with me where we need to see more research in both the long-term
Mhm.
effects across development and time, and then also those shorter term kind of day-to-day state-based fluctuations in body image as well.
Awesome. There's some more theses for those who are listening, and possibly even dissertations.
Yeah, hey,
Yeah.
do it. Call me.
Yeah.
Let's do
Yeah.
it.
Yeah. um, I wanna wrap with so any advice that you have for anybody listening right now that does struggle with their own body image, whether it's just a little bit, a short inflection in their life, or something that they've been struggling with long term. Any tips or messages that you'd like to leave them with today?
Yeah, yeah. I the first thing that I guess I would convey is just a message that even though it doesn't feel this way, you are not alone in that feeling. Um, Body image is also such a sensitive topic to talk
Mm,
about sometimes that ends up being something that we don't talk about then with other people
yeah.
because we're ashamed or we're embarrassed. But just know that I can almost guarantee you are not alone in the struggles and the concerns that you're having. A- And I would also just leave to listeners who are struggling with some type of aspect about their body image to I would go out there to say that I might venture to probably guess that the concerns you're having are not any fault of your own, but are
Yeah.
probably stemming from messages that you have been sent since you can even remember regarding whatever that concern is that you're having. Um, and to all that to say, just know that there are resources and there is support, be it in terms of books, in terms of therapy related work, and a whole host of other things. There certainly are ways to address those concerns at a point that you might feel like you're ready to go on that adventure. But yeah, just know that you're not alone. And for so many of these concerns, it's something that I can almost guarantee probably is not of any fault of your own, but is
Mhm.
something that has stemmed from messages that you've been sent for a very long time.
Thank you for that, Zach. Appreciate it.
Yeah.
In closing, here at Ego Overhead, we do love nonprofits, and we want to give as much awareness as possible to as many nonprofits and the great work that they're doing.
Yeah.
Do you have a nonprofit that you'd like to give a shout out to and that we can highlight this week?
Yes,
Yeah,
for
yeah,
sure.
yeah.
The organization I wanna talk about is Centerlink. So
Mm,
Centerlink is the community of LGBTQ centers, and it's a global organization for folks that aren't familiar that's focused on, supporting and connecting local LGBTQ community
mm,
centers together. And so in this way, Centerlink acts as a
mm,
central hub to provide resources, advocacy related work, and training in mental health.
awesome.
I'll give a shout out that myself and some of my colleague peers are currently providing trainings in an LGBTQ affirmative cognitive behavioral therapy intervention
Mm,
that has been supported by Centerlink across the country. So just want to give out a shout out to them and all the really impactful work that they do across mental health, physical health, sexual health, advocacy for the LGBTQ community.
Awesome. Thank you for that. We'll have a link to Centerlink in the show notes as
Perfect.
well. And for our listeners that want to follow your work or get to know more about you, where can they find you?
Yes. So you can find me probably the most information on my webpage,
Perfect.
which Austin, perhaps you can link as
Yeah,
well.
we'll have that right in the
The
show notes.
Yes. The
Yes.
webpage is it'll be written out, but it's
Yeah.
bisglab.wixsite.com. And so there you can keep tabs of all the cool research and other really amazing things that our lab, shout out to my graduate students and undergraduate students who are just doing some really, really cool LGBTQ related work broadly, particularly related to body image.
Awesome. Thank you for that. So thank you, Zach. Your time today was really awesome. I mean, I really enjoyed this conversation. I think we covered a lot of great
Yeah.
stuff. We could have probably kept going for hours and hours. um,
Yes.
yeah. But your research, your clinical insight, and this deep commitment that you have to understanding stigma, community, identity, and how it really shapes the way that we think and relate to our bodies is really valuable. So I really do appreciate your time today. And for our listeners, if there's one message that I'd like to leave you with, I think it's that body image isn't just about appearance, just like Zach was sharing, it's about belonging and safety, identity, and the stories that we're told about what it means to be enough. And for LGBTQ plus individuals, especially, those stories are often shaped, just like Zach was sharing, outside of the self. But they can be rewritten through connection, compassion, and affirming care through wonderful clinicians like Zach and so many others. So, if any part of this episode resonated with you today, please do consider taking a moment to reflect on the pressures that have shaped your own body image and the people, communities, and practices that help you feel grounded in who you are. So, if you want to learn more about Dr. Soulliard's work, you can find him at Miami University or the links in the show notes and explore his lab's research online a little bit further. We'll also be highlighting him on our social media pages. Uh, with that, thank you again, Zach. This was great. Thank you so much.
Thank you so much, and thank you all for listening.